Good afternoon po sa ating lahat. It is my honor to represent our handsome Mayor, Vico Sotto. Apology po sa inyo because he unable to attend to this occasion. So, tagaan na lang po kayo sa akin. Okay, so the Pasig City TCI journey began with amid steady gains in maternal, adolescent, and reproductive health. Barely a year after the pandemic, the city was meeting its key health targets, the antenatal, the postnatal care, to full immunization coverage and contraceptive prevalence. Maternal and under 5 mortality have been declining. This achievement paints a rosy picture of a city truly in the pink of health, with women's health and well-being at the forefront. As one of Mayor Vico Sotto's 5 main agenda, our department has received substantial support. From the start, the goal has been clear: achieve universal health care with 100% PhilHealth coverage and fully digitized city health facilities. Through partnership with TCI for IT system, Ateneo de Manila University, and the British government for digital tracking program on non-communicable diseases, we move closer to that vision. Even before UHC required it, we rationalize our human resource to meet WHO standards. Today, every health center has a full complement of professionals, close if not higher than WHO recommended ratio. For one physician per 20,000 people, we stand at 1 per 8,500. For nurses, at 1:10,000, we have 1:3,200. For midwives, which is 1:5,000, our is at 1:6,100. We also aim to double the number of our Pasig health aides or PHA. This is our city retained barangay health workers before the end of Mayor Vico Sotto's terms in 2028. Even before our partnership with TCI, our efforts of women and adolescents were already in motion. Through the Adolescent Health and Development Program, all 42 health centers were made adolescent-friendly, with personnel trained accordingly. The National Safe Motherhood Program continued to reach mothers through Pocket Buntis Congress events with our 2 city-retained hospital. Our surveillance, monitoring, and implementation team traced on facility-based deliveries and capacitated them on the importance of proper facility-based and skilled birth attendance. Our family planning program also strengthened community demand through capacity development, usapan series, and katropa session. Yet, those at the margins will always be the first to show symptoms of inequity. In the case of Pasig, it is adolescent and teenage pregnancy. While fertility rates overall have declined, they remained in the low 20s per 1,000 adolescent birth rates. Those getting pregnant at a younger age, as well as the number of young people diagnosed with HIV/AIDS are increasing. I have been part of this journey for a long time. As a member of the city leadership team from 2013 to 2018 under the city leadership governance programs by the Department of Health, the Development Academy of the Philippines, the Swilig Family Foundations, our focus was addressing high maternal mortality rate. By strengthening our health system through a system-based approach targeting the 6 building blocks of health, we successfully brought those numbers down. Now, we face with the same problem with different young face still pertaining to maternal health, but something more insidious and generational. That is why our partnership with the Challenge Initiative through the Swilig Family Foundation, the Gates Foundation, came at a opportune time when then Councilor Cory Raimundo, he is sitting beside there, known for her trademark brilliance as a faculty at the UP Population Institute and public servant at almost a decade, challenged us to rise to the demands of this partnership. Our team answered affirmatively with trepidation. Under her guidance, we anchored our work on three principles: right-based approaches, gender sensitivity, and observance of safe space. The 2 years of this project was flurry of activities and personalities. Our small core group of less than 10 people tripled with people from all sectors of Pasig City. Of course, we have youth sectors through the Sangguniang Kabataan and the Youth Development Office, but we also youth partners from the schools and community when we conducted our lectures and community youth surveys on sexuality and behavior. We have been able to engage partners in the health sectors, specialists, private practitioners like the Midwives Association of Pasig, as well as other stakeholders, the DepEd, CSWD, and PMP. When we came up with integrated service delivery network, in series of painstakingly tedious and contentious consultative meetings which resulted in its adaptation and presentation to barangay officials. Our maternal health programs views teenage and adolescents' pregnancy not as a medical condition, but more a violation of one's human rights, and as such, partnered with the women and child protection programs of both hospital in their case management. Recognizing the adolescent births face higher risk of complications, we established a referral network that considers system capacity and transportation logistic across all hospitals and birthing facilities. No teenage or adolescent mother should end up giving birth in a lying-in facility or worse, at home because hospitals are full. Our system now ensures proper referral, conduction, and admission. To prevent repeat pregnancy, the family planning programs has instituted an informed consent-based initiative which reaches out of both teenage and adolescent mother and her parents or guardians regarding the option of initiating family planning methods. We have also utilized our mobile family planning clinics to provide family planning counseling and commodity dispensation in area with issues regarding geographic access. Also, all health centers have personnel who have undergone competency-based training in family planning. Our partnership with the TCI has been success in many ways. It has changed mindset and transformed the way we work by embedding bridging leadership into our innovation process. Where we once operated in silos, we now practice ownership, co-ownership, and co-creation. This shift has allowed our partners to transcend what is personal into a shared vision, which brought institutional changes geared towards equity. Still, our journey is far from over. Comprehensive sexual education remains to be institutionalized in schools, as well as an ordinance on community-based teen centers. The need to adopt bridging leadership cannot be overemphasized. We are in time when the youth have multiple headwinds coming up against them. With the advent of technology, globalization, everything has just become 1,000 times faster and more complex. It is a challenge that we have to take up upon ourselves. Be one with the young and in coming up with solutions that will strengthen them, help them face the challenge of the times, adolescence and teenage pregnancy, mental health issues, and the growing threat of early onset non-communicable diseases are but some of them. We have to craft policies not just for them, but with them. So, marami pong salamat. Sa Pasig po, umaagos ang pag-asa, sabi ng aming mayor. Thank you po. Magandang hapon po.